Okay, so first of all, I would just like to introduce myself. So I'm Angela Konopate. I live in Scotland and I've been in the optical world for over 40 years. And in the last 8 years, I've really focused on dry eye and lid hygiene because I feel as if lid hygiene is something that is partly missed or not spoken about on a regular basis. So I'm here today really just to highlight the need to think about lid hygiene and discuss lid hygiene on a daily basis with our patients. So yeah, I'm just going to have a slight discussion just so that I can highlight the need and you can think about it perhaps in a slightly different way at the end of this little presentation. Next slide. So really this slide was for you to have a look at these different images and think about what we see on a regular basis and what we actually do to our lids and lashes on a regular basis. So obviously through opticians we have blepharitis, meibomian gland dysfunction, but we don't all, and dry eye, which all comes under the one umbrella, but we don't necessarily think about the makeup that we use that can obviously have a massive impact. Also contact lens wear, the environment, allergies. We don't think about the battering that our lids and lashes take on a daily basis. And although we are recommending spectacles, contact lenses, and we're really looking after the behind the eyes, we're not actually focusing on lids and lashes as much as we should be. So really, if you think about it, from birth, our lids and lashes actually begin to, the bacteria starts to develop from a really early time, and we don't actually clean our lids and lashes on a daily basis. Next slide, please. So the eyelid margin is the only place, believe it or not, on the human body that never routinely gets cleaned properly. And when I say cleaned properly, what I mean is we wash our faces in the shower. We sometimes use maybe makeup wipes, soap and water, but we don't actually use something that kills the bacteria that actually rests on those lids and lashes. And that bacteria builds up and builds up and builds up. Eventually it's like a fortress, and it's called a biofilm. And unless we actually clean the lids and lashes on a regular basis, we really can't help to break down the different strains of bacteria that rest on our lids and lashes. Now you might think, well, I can't see it, it's not really bothering me, but eventually it does bother, and it really starts from a young age to teenagers all the way through to 100-year-old. Literally, we just have to make sure that we understand what's happening and we make sure that we're discussing lid hygiene on a regular basis, because what this causes is it causes the buildup is at the base of the lashes. It then can cause inflammation, which leads to dry eye, blepharitis, meibomian gland dysfunction. But even if it's not as extreme as that, it still means that even if you're putting your contact lenses in, your contact lens is not going onto the surface of the eye on a clean foundation. So if you think you want to put your makeup on, but there's a lot of bacteria there, or you're putting your contact lenses in, that bacteria is getting passed onto the surface of your lid hygiene, of your ocular surface, which starts that inflammation cycle, which we want to get into the habit of cleaning on a regular basis so that we can do our best to break that down. As I said earlier, there are 7 strains of bacteria. There's actually more than 7 strains of bacteria, but there are lid wipes and foam out there that breaks down that bacteria and actually means that anything that you're going to do on a daily basis, you've cleaned that area so your eyes are more comfortable from morning to night. It's imperative to clean your lids and lashes to reduce or to help to reduce dry eye, meibomian gland dysfunction, blepharitis, contact lens comfort. Wearing makeup, like we don't think about that either, but when you wear makeup, whether it's waterproof mascara, or like I've actually got it on just now, believe it or not, my eyes are a little bit stingy. Like when you put eyeshadow on, it's the glitter, it's almost like rocks on the surface of your ocular surface. So just so important to clean that surface on a regular basis, to take away any bacteria, and then you're starting the day on a nice clean surface. Next slide, please. Now, the good way to think about daily lid hygiene is to think about how often we brush our teeth. Now, over 100 years ago, we didn't brush our teeth, and there was lots of issues where they just used to pull teeth would fall out. Well, now we have to look at our lid hygiene exactly as we would look at how often we clean our lids and lashes. Literally, the same thing is happening with our meibomian glands as was happening to our gums 100 years ago, and we want to get ahead of that cycle. We don't want to wait until there's an issue. We want to clean our lids and lashes daily, the same as we brush our teeth daily. The lid hygiene, whether it's wipes or foam, it will take away any of that bacteria that we don't normally clean. And as I said earlier, it is actually making sure that your ocular surface is comfortable throughout the day. There's like less inflammation, your contact lenses are comfortable, you're taking away any like slithers of makeup that you think you've cleaned, but actually if you clean your makeup, if you clean the makeup off your eyes and then you go back to use a foam or a wipe that is recommended by leading experts, you'll notice that there's quite a few particles of makeup still on that that wipe, and that shows that if you're not cleaning that away, that just builds up and causes inflammation and causes discomfort. What it also does as well though is if we don't clean our lids and lashes on a daily basis, what we find is even if something as simple as going in to collect our new glasses, if we have dry eye, that causes your vision to fluctuate. And if your vision fluctuates, then what that means is when your customer patient is coming in to collect glasses, they might blame the lenses that are in the spectacles, or they might blame the optician because they say, no, I can't see very clearly. But as we know, dry eye fluctuates. Some days your vision's good, other days it's not. But if you're being proactive and cleaning your lids and lashes on a daily basis, then what that means is you're giving yourself a really good chance to stabilize that vision and stabilize the tear film. The way I look at it is you wouldn't build a house on shaky foundation. Why would you either wear contact lenses, buy expensive new glasses, wear nice makeup or false lashes when the base of your lashes is full of bacteria? So it's as simple as thinking, clean your lids and lashes as regularly as you would brush your teeth. So what I mean is you don't need to obviously brush your teeth 2 or 3 times a day. You want to clean your lids and lashes at least once a day would be perfect. Even every other day would be perfect, but anything is better than not doing it at all and not having that conversation with your patients to explain the importance of daily eyelid hygiene. It's so simple as well. That's the other thing. It's so simple. There's so many foams and lid wipes out there. Literally, you just put it on, leave it on, and you're good to go. So it's not even as if you have to do anything spectacular, anything different. Just literally put the foam on, good to go, or use the wipe, and you're good to go. And you know that your lids and lashes are clean and set up for the day. Next slide, please. We've touched on obviously contact lens wearers, but what is so important and what many experts will say is before you even fit a contact lens, you have to make sure that that surface is clean. And if you think about it, if there's any bacteria on those lids and lashes, that will get transferred onto the contact lens, which will in turn get transferred onto your ocular surface. And what does that actually mean? Well, that means that you're starting that inflammation cycle. That bacteria will start your contact lenses perhaps a third of the way or 2/3 of the way through the day. You start to feel discomfort. So you want your lens to be as comfortable as possible. And every time you blink, if there's bacteria there, it's just helping to cause that inflammation cycle or start that inflammation cycle. So important to make sure your lids and lashes are nice and clean, free from as much bacteria as possible before you put your contact lens in. And especially with new contact lens wearers as well, they might think it's okay to feel a bit of discomfort. Well, initially, perhaps it is, but it's not okay to feel discomfort on a regular basis. And most times we find that our contact lens patients will come back into practice, mostly not because they can't see, but it's because they're feeling discomfort. But if we can eradicate the bacteria that's been transferred over, then what you will find is you'll reduce a fair bit of tear time from patients who actually are in the habit of cleaning their lids and lashes on a regular basis. So you can actually rule that out and say, well, it's not bacteria that's causing the issue, it may be something else. So the comfort is massive, but also what it does is it's helps to stabilize the vision. We're not improving the vision, but we're stabilizing it because the tear film is stable and that ocular surface is nice and smooth. Then that means the contact lens is going to feel much more comfortable on the eye. And when you're blinking, you're not blinking like bacteria or any bacteria that's going to scratch that surface or get under the contact lens. You're actually making sure that that surface is nice and clean. It supports obviously to prevent dry eye and obviously blepharitis and meibomian gland dysfunction. Again, they all come under the same umbrella. So when you talk about dry eye, blepharitis, meibomian gland dysfunction, and contact lens wearers, you have to make sure that hygiene is of the utmost importance. It's saving your patient so much time, energy, pain, inflammation cycle you're reducing, but it's also saving you guys time as well. Supports to improve comfort, as I said, and can improve the wearing time. So instead of getting to 3 o'clock in the afternoon and your eyes are itchy, sore, red, and you want to take that contact lens out because you blame the contact lens, do we ever think it's actually not the contact lens, but it's the bacteria that we've actually not cleaned off properly the day before, the week before, the month before? So yeah, really important to make sure that that contact lens is going onto a nice clean surface. There's just no point spending all that time with a patient, but you're not talking to them about the hygiene. We talk about keeping the contact lenses nice and sterile in a case. We talk about using the cleaning the contact lens, but we don't actually talk about the lid margin and the eyelashes and the lids, which can actually contain a lot of bacteria. And it's just important to take it right back to there, clean the lids and lashes, and then move on to do what else you want to do, whether it's contact lens wear or spectacle wear. Next slide, please. Something that we don't talk a lot about, certainly from an optical point of view, and that is the impact of makeup. So we have obviously false lashes, we also have makeup, and yes, that is an extreme picture there, but it's to show you that probably a lot of that area is covered in a lot of bacteria that we're not actually cleaning off on a regular basis. And if I could just speak about false eyelashes for a minute, like, we're supposed to have our eyelashes at a certain length because that protects the ocular surface. But when we wear really long eyelashes, yep, they look amazing. But when we wear them, what happens is you get bacteria trapped in there. If you get any allergies, pollen, etc., everything gets trapped onto those lids and lashes, and especially the false lashes. So it's so important that we're keeping that bacteria away and cleaning the lids and lashes. And if you are wearing the lashes that you keep in for, like, I don't know whether it's 3 months or a month or whatever, when you go to take them off, make sure you're getting in to clean all that area, but you can still clean gently around that area when you're wearing the false eyelashes as well. Another thing to think about is mascara. You just think, right, I'll put my mascara on, take it off at the end of the day, but there's certain waterproof mascaras and other mascaras that have toxins in it, so just be really careful what makeup maybe your patients are using. Just if they come in and say, I can't get rid of this dry eye, or just ask the questions. What makeup do you use? What does your routine look like? Because a lot of these amazing makeups have toxins in it that actually triggers dry eye and damages the ocular surface. So it's so important to make sure we're cleaning that area on a regular basis, and we're not going overboard. Yeah, we can still look amazing, but at the same time, the whole area, not just the lids and lashes, but that whole surrounding periocular area, it's so important to make sure we clean that with the foam or wipes on a daily basis. Eyeliner as well, so we tend to want to put eyeliner right inside the waterline, and that's where our glands are, obviously where the oil comes out. So we want to make sure that we're not putting it on the waterline, and if we have to put it on the waterline, which we wouldn't recommend, you want to make sure that you're cleaning that off with a proper leading brand of foam or wipes. Approximately, as it says there, 66% of people wear makeup, and 66% of people will not be making sure that they're cleaning their lids and lashes. If I was to ask everyone here today, like that's on the call, like how many of you actually talk about lid hygiene or speak to your patients about lid hygiene on a regular basis, or how many people actually clean their lids and lashes with a recommended lid wiper foam, I would probably bet there would be maximum maybe 5 to 10%, and the other 90%, although we are in the field of being the experts, we're not actually making sure that we're recommending the importance of lid hygiene. And it's just for you guys to think about, wait a minute, when was the last time I saw a patient, and when was the last time I actually recommended lid hygiene? How many dry eye patients did I see, and did I ask them what is their lid hygiene routine? It is so easy. The experts have made it so easy for us all to actually just use at home. It's really simple, it's really straightforward, it doesn't take much time at all, but the impact of just daily cleaning our lids and lashes makes such a massive difference from our day to day. People might think, oh, it's just dry eye or it's just a bit of redness, but actually if you add to that lockdown, the fact that we're constantly using our computers, we're using our computers more, winter's coming in, we've got the heating on, so that impacts your eyes as well, your lids and lashes. Every area of the environment will impact our lids and lashes, so it's just so important. If you remember the foundations of that house, it's exactly the same thing for our lids and lashes. Start at the beginning and then work back the way to try and work out what it is that's causing the patient's inflammation or discomfort. And let's reduce that irritation, and let's get that ocular surface as healthy as we possibly can, and it will really impact your lifestyles, but also impact mainly the patient's lifestyle as well. Next slide. I wanted to just leave you with this image. I know it's not a very pretty image, but this is Demodex. Now, we all have these little mites, and they live on the base of our lids and lashes, and that's absolutely fine. We need it. They come up at night time, they just eat a little bit of any food source that's there, any debris, any skin, and they go back down at night time, and that's absolutely fine. That's the cycle, and it's healthy. But the problem is when we add irritation to that, when we add patients that have blepharitis or blocked glands, these can actually colonize. So there can be so many more, and we need to manage them. So again, most importantly, if we keep our lids and lashes clean, we can do our best to keep these, I was going to say little fellows, but they're men and women, they're male and female. We can keep these male and female mites away. So it's so important that it's not just, oh yeah, let's keep our lids and lashes clean. It's so important to kill that bacteria that starts that inflammation cycle. So important, because it affects patients' contact lens wear, spectacle wear, makeup wearers, staring at screens. We're also seeing more and more younger people coming through, age 7, 8, and 9, with blocked glands because they're constantly staring at screens as well. So we have to be talking about lid hygiene on a daily basis to every single one of our patients, and just make sure that we are talking to them about it, and then it's their choice if they want to go ahead and do it. But at least from our duty point of view, we have covered everything. So that was just like a very light discussion around why it's so important to clean our lids and lashes on a daily basis. Really straightforward, and most importantly, to use a wipe or a foam that is recommended by experts. And obviously baby shampoo, absolutely a no-no, because that can cause dry eye. Look out for certain cosmetics that have toxins in it, again can cause dry eye. Yep, and just make sure, same as brushing your teeth, you're cleaning your lids and lashes on a regular basis. Thank you.
Thank you, Angela.
You're welcome.
I see we have no questions in chat. Maybe I can ask you a question.
Sure.
We were discussing here, because in this conference hall we are some lecturers, we were discussing whether a perfectly healthy person needs everyday lid hygiene. Because of course, whenever we see something, some signs, disorders, or symptoms of discomfort or irritation of the lid, swelling and redness, this is an indication to do the thing. But we see and we know that in theory, if a person is perfectly in balance and well, then nothing is needed. The same about the teeth. We know that the ancient people whose skulls we see in the museums, they have better teeth than we do. And actually, they didn't brush their teeth. They had healthy food and all the mouth things were in balance, and so nothing was needed. What about lid hygiene? Does a perfectly healthy person needs it? What do you think?
So first of all, let me say it is so important to have a healthy diet is important. So it's not just keeping your lids and lashes clean. It's so important to have a healthy diet, to drink plenty of water, to have your fruit and veg. That is so important. But as I said right at the beginning, when we are born, that bacteria starts to build up in the base of those lashes, and it just builds up and builds up and builds up and becomes a fortress. So that is why eventually some people will have issues with dry eye earlier than other people. It's just your makeup and how badly it's going to affect you. But it is so important, no matter how good your diet is, no matter you stay out the sunshine, you don't have stress, it's so important to clean the lids and lashes, because that bacteria just builds up and builds up. So no matter how healthy you are, it's good to be organized. I want to say organized, that's the wrong word. It's good to make sure that you are cleaning your lids and lashes on a daily basis to get rid of that bacteria. So no matter how healthy, yes, the answer is yes, you still have to be cleaning your lids and lashes.
And many of my patients come and when I have this talk about lid hygiene, they say, oh, I'm cleaning my lids and lashes, I'm cleaning my eyes with the makeup removers, because I put makeup on and take it off with the micellar water and some makeup removers. And they think and they suggest that it's a cleaning ritual, not makeup removing. What's your comment about this?
So my comment about that is good that they're cleaning the surface, but they're not using a leading, like the experts make these lid wipes. They do a lot of clinical trials to really focus on the bacteria that sits on the lids and lashes. These makeup wipes and other wipes don't do that. So it's so important that you're using a wipe that actually kills certain strains of bacteria that causes that inflammation cycle. So whilst it's great that they're using makeup wipes, at least that's like a stage 1. The stage 2 has to be making sure you're using a product that is recommended by leading experts in the field.
And could you explain why baby shampoo is no? Because in Latvia, I know that the soap and baby shampoo is very popular recommendation about specialists. Why is it bad?
Right, so I'm not sure how far your investigations have been done where you are, but certainly in the UK, they have done a lot of clinical trials, and it shows that it is good for causing a lather, like a soap lather. So it's going to move any bits of debris, but what's in the baby shampoo actually disrupts the tear film. They have shown in clinical trials that it disrupts the tear film and it causes dry eye. So as much as it's moving some of the debris from the lids and lashes, it's actually disrupting the tear film. So it's whatever is in the baby shampoo is disrupting the tear film and causes dry eye. And many, many years ago, all we had was baby shampoo. That was like a bit like an old wives' tale, shall we say? An old folks recommendation, but since then we've come so far since then. And as I say, the trials prove that baby shampoo is actually one of the worst things to use on a regular basis to clean your lids and lashes. I have to say as well, actually, in the UK, Johnson & Johnson, who make, is it Johnson's baby shampoo? They actually put a letter out to people to say they are making sure that they are not recommending that for dry eye. So they've actually also done that in the UK as well. So they are removing themselves from that recommendation because they've seen the trials and they know that actually it's not something that we want to be recommending now. Time to move on and leave the baby shampoo in the past and leave it to the experts to get that bacteria killed.
Thank you. I think this was a great presentation, and we got some new insight in eye hygiene, how it's done in UK, and we have things to learn in Latvia as well. Thank you for your presentation, and if the questions will arise, I will forward them to you, or maybe try to answer them myself. Thank you for joining us. Have a nice day.
Thank you. Thank you, everyone. Bye.
Bye.